Welcome to our caregiver session on mental health. Today we will be covering various topics relating to caregiver mental health, as well as some activities you can perform when you are feeling stressed or overwhelmed. These activities include self-compassion, which occurs approximately at the 13-minute mark of this presentation and lasts for 1 minute, and deep belly breathing, which occurs approximately at the 15-minute mark and lasts for 1 minute and 15 seconds.
Since the pandemic has started, stress for you as caregivers has risen. There are new disruptions in your daily routines that have influenced things like childcare, work responsibilities, economic stability, and social interaction with others. Preschool-age children rely on their caregivers to provide them with caretaking routines that support their development. When these routines are disrupted, for instance, how the pandemic has disrupted your routines, it can influence your child's development. During disruptive times, and in general, it's important to maintain positive mental health and self-care. As caregivers, you should prioritize your own mental health because parental stressors can directly affect the well-being of your child. Anytime that stressors appear in your life, your child can sense worry, which could negatively affect their emotional wellness and their ability to cope during challenging situations. You as caregivers need to remember that it's important to prioritize your own social, emotional, and mental health in order to provide support to your child. I want to invite everyone to think about what they see when they view this cup of water. Is it half full or half empty? Some people may see the glass half full, while others see it as half empty. The water in the glass is the same for everyone, but your thoughts affect the way that you interpret it. This same thing happens throughout your day-to-day life. The thoughts that you have can affect how you perceive a situation. These thoughts that are first to come into our head are called automatic thoughts, and some of these automatic thoughts can be beneficial. For instance, if you're driving in a snowstorm, a thought that might pop into your head is to slow down and be careful. But sometimes these automatic thoughts can be unhelpful and put a negative impact on what you're thinking in the moment. For example, if you walk past somebody that you know and you wave to them, but they don't wave back, a first automatic thought that might come to mind is, oh, they must not like me if they didn't wave back. And you may start to feel emotions such as embarrassment or sadness. But that unhelpful thought may just be misinterpreting the information. Maybe your friend didn't see you wave, or they were in a rush. There are so many other outcomes that may be the truth of the situation, but because of an unhelpful thought, it can affect how we feel and how we act after interpreting it. It's important to understand that our thoughts are interconnected with our emotions and our behaviors. Our thoughts give meaning to a situation, and how we think can affect how we feel and act, but also how we feel can affect how we act and think. And the same goes for how we behave. They all influence each other. A situation that might happen is you make a simple mistake like burning dinner. This might make you think an unhelpful thought like, I can't do anything right. This may make you feel angry and upset. And then this may lead you to behave by doing things like withdrawing or snapping at your family. It all started with an unhelpful thought that affected the outcome of the situation, and this may lead you to feel down on yourself and act based on those emotions. It's important to try and recognize those automatic, unhelpful thoughts that may occur. By trying to recognize and examine the truth behind unhelpful thoughts, it allows us to better understand our emotions and regulate them before they get too intense and overwhelming, where it starts affecting our behaviors in a way we don't want. So what can we do to recognize unhelpful thoughts before they affect how we feel and act? One strategy is using a thought record. Writing things down is a great way to rationalize and comprehend your thoughts, and the goal is to change an unhelpful thought to an alternative thought. There are several parts to a thought record. First, you need to write down the situation in detail. What were you doing? Who was there? What happened? Then you need to determine your mood on a scale of 1 to 100. And this can be any emotions you experience, along with any physical sensations that you feel in your body. Then you need to determine what unhelpful thought you have. It can be one that sticks out to you and is causing the most intense emotions. Then you need to rationally find evidence that supports your unhelpful thought, as well as evidence that does not support your unhelpful thought. This will bring you to think of an alternative thought to be rational about the situation. And it's important to rate your emotions again to help you visualize your feelings. If you want to do a thought record, it's important to try and do it within a 30-minute window of when the situation happened. This way, you're acting on it fast and trying to change your unhelpful thought before it affects how you feel and behave. As a parent, the situation could be, I was replying to work emails while my children are arguing. Emotionally, I feel nervous, irritable, sad, and guilty, and I physically feel knots in my stomach, tightness in my neck, and my heart was racing. The unhelpful thought that comes to mind is, what if my children think I'm a bad mother because I don't spend a lot of time with them and work all the time? The evidence that supports this thought is that I work full time, I constantly check my phone, and the kids are arguing. The evidence that does not support this thought is that I make sure I'm around for the kids before school and at bedtime. The kids play well together most of the time. I'm aware of the importance of spending quality time with them, and my children tell me they love me and like spending time with me. The alternative thought would be, even though my kids are arguing while I'm checking work emails, that doesn't mean they think I'm a bad mother. After re-rating mood and physical sensations, it helps to visualize how you're feeling after changing your thought process. Doing something like this to recognize unhelpful thoughts can be beneficial for your mental health. It provides you with a way to understand your thoughts, emotions, and actions and interrupt any unhelpful thinking that might be disrupting your daily life. An example of an unhelpful thought that may come up in your day-to-day life about your child's behavior is a thought that tells you, my child doesn't listen. An alternative thought that you may consider is, my child doesn't always want to do what I ask of them, and they don't understand the importance of tasks I ask them to do. By altering negative, unhelpful thoughts that you have about your child's behavior, it allows you to understand the situation with a clear mind and act in a way that won't make the situation more stressful. For instance, if you had that negative thought that your child doesn't listen when you ask them to brush their teeth, it may cause you to feel upset and frustrated, and then you may behave by yelling at them to go to the bathroom and brush their teeth. By yelling and lashing out, it makes it harder for your child to comprehend what you're asking and may cause them to get upset as well. Thinking back to our alternative thought, they may not understand why brushing their teeth is important, and therefore they may not want to do that task. If you recognize alternative thoughts, it'll allow you to comprehend why your child is acting the way they are, and can allow you to have a clear mind to use strategies to initiate a desired behavior from your child. One strategy that may be helpful is viewing the situation from your child's perspective. Your child may be in the middle of playtime, so obviously they would prefer to continue playing instead of brushing their teeth. You could tell your child, I know you're having so much fun playing with your cars, but it's time to brush your teeth. Let's do it super fast so we have more time to play with your cars after. This strategy validates how your child is feeling about the situation. It also allows you to provide an alternative explanation and solution, which can help your child to be more compliant with brushing their teeth. Another strategy that could help with initiating a desired behavior from your child is by providing them with choices. You could tell your child, do you want to walk with your toy cars to the bathroom, or would you like me to carry you with your toy cars to the bathroom? Providing them with choice makes them feel like they have a sense of control in the situation. Another strategy that may be beneficial is making the task fun. You could tell your child, let's go to the bathroom and make funny faces in the mirror while we're brushing our teeth. You could do this with your child and see who can make the funniest face. By having a sense of fun associated with a task that your child may not enjoy, it can ease the resistance that you may get from your child about doing the task. Now we're going to shift our focus and talk about the effects of stress on our mental health. Often when we think of stress, we indicate it as something bad, but not all stress is bad. Stress is a normal part of our everyday lives. Positive stress is good in small doses and can be beneficial when working to complete daily challenges and acts as a source of motivation. For example, if you were going to a job interview, positive stress would keep you on track and focused. Stress can become negative when it starts interfering with our daily functioning. If we're undergoing prolonged negative stress, it can affect us in many ways. You may start to feel anxious and experience unpleasant feelings. It may also begin to affect your motivation to be able to do daily activities. And it may also affect your mental and physical well being. It's important to try and recognize negative stress that we may be experiencing, because if we let that stress become overwhelming, it can lead us to a breaking point that may result in an outburst. For instance, your child may be banging toys together, and instead of asking them not to do that, you yell at them out of frustration and irritation. That outburst may feel like it came out of nowhere, but our body gives us cues to let us know that we're experiencing stress. It's important to try and recognize these body cues before they become too overwhelming. This allows us to step in and take control of our stress, which can help to prevent stress outbursts. Some body cues that we may experience are body aches and pains, chest pain, a racing heart, exhaustion or trouble sleeping, headaches, dizziness, shaking, muscle tension, jaw clenching, digestive problems, as well as a low sex drive. Everyone's different, so it's important to listen to your body. A strategy that you could do to check in on your body cues is to simply set an alarm. Maybe having one set every hour or two in order to allow yourself to stop, be in the moment, and listen to your body. This will allow you to recognize stress before it becomes too intense. If you feel that you're experiencing any of these body cues, you can utilize self-care strategies to calm your body and mind, and we'll be discussing some of those strategies next.
We would now like to provide you with what we like to call a wellness toolbox. A wellness toolbox contains various strategies that you can implement when you're feeling overwhelmed or stressed. Self-compassion can be defined as compassion turned inwards. It is how we perceive ourselves in experiences of seeming failure, inadequacy, or personal suffering. It can support parents by alleviating difficult thoughts and emotions, while promoting gratitude, optimism, self-awareness, and positive emotions linked to well-being. Self-compassion is an extremely relevant tool for caregivers, especially during the pandemic. You may consider incorporating self-compassion into your daily life if you find that you have challenges managing your own self-care, balancing tasks, or you experience feelings of self-criticism, self-blame, or guilt. Self-compassion among parents has been associated with lower self-criticism, self-blame, shame, and guilt, as well as lower symptoms of psychological distress, anxiety, and depression, and higher subjective well-being. This in turn has been associated with lower child-directed criticism, insecure child attachment, decreased child behavior problems, and increased quality of life. There are many different activities that can foster self-compassion. It is important to remember that self-compassion is a skill that requires patience and practice. This slide shows some activities that you can do to introduce yourself to self-compassion, as well as further activities that can be used to build your self-compassion. Links to all of these activities and more can be found on our website under the Mental Health module. Before we move on, we are going to take a self-compassion break ourselves. I want you to think of a situation in your life that is difficult, that is causing you stress. Call this situation to mind. See if you can actually feel the stress and emotional discomfort in your body. Now say to yourself, this is a moment of suffering. This hurts. This is stress. Suffering is a part of life. Other people feel this way. I am not alone. We all struggle in our lives. Now put your hands over your heart. Feel the warmth of your hands and their gentle touch. Now say, may I be kind to myself. May I give myself the compassion that I need. May I learn to accept myself as I am. May I be strong. May I be patient. Thank you for participating. This break can be used at any time to evoke self-compassion when you need it most. Deep breathing is a great way to relax, reduce tension, and relieve stress in the body. When you breathe deeply, it sends a message to your brain to calm down and relax. The brain then sends this message to your body, resulting in a decreased heart rate, slower breathing, and decreased blood pressure. Not only is there a great variety of breathing exercises available, such as belly breathing, 4-7-8 breathing, and a variety of apps, but breathing exercises are also easy to learn, can be done at any time, and do not require special equipment. Before we move on, let's try out belly breathing. First, find a comfortable position to either sit or lay flat in. Put one hand on your belly, just below your ribs, and the other hand on your chest. Take a deep breath in through your nose and let your belly push your hand out. Your chest should not move. Breathe out through pursed lips as if you were whistling. Feel the hand on your belly go in and use it to push all the air out. Do this now 3 times and take your time with each breath. Notice how you feel at the end of the exercise. Thank you for participating. Belly breathing is one of the many exercises that can be done when you feel the need to relax. Mindfulness involves awareness of what you're sensing and feeling in the moment without interpretation or judgment. It can be described as the art of non-doing. It's simply noticing what's happening in the moment without reacting and allowing thoughts, feelings, and impulses to pass rather than pursuing them. Mindfulness can be used to decrease symptoms of stress. There are many different ways in which one can practice mindfulness. You can pick whichever method you best find suited to you. Just like self-compassion, mindfulness is a skill that takes time, practice, and patience to build. Some activities to get started in mindfulness include walking meditation, mindful of sound, body scan, and open awareness. Descriptions of these and more can be found on our website under the mental health module. Grounding exercises can be used to bring yourself back to the present moment when you're feeling overwhelmed or stressed out. If you find that you often experience strong emotions or that you engage in stressful thought cycles, grounding exercises could be useful for you. Like many of the strategies presented, there are a variety of grounding strategies available, so you can pick whichever you find best fits who you are and your lifestyle. Some examples of grounding activities include the 5-5-5 technique, in which you name 5 things you can see, 5 things you can hear, and 5 things you can touch, taste, or smell. You can hold an object, noticing its shape, texture, and color. You can utilize essential oils, noticing the scent, or you can splash cold water on your face, noticing how it feels. Many more of these examples can be found linked on our website as well. This slide highlights a variety of resources that you can reach out to. It's important to remember that you are not alone. Thank you for taking the time to listen to our presentation. We hope that you come out of this with some helpful strategies to manage your stress.